First, we can explain what is head neck cancer. It's actually cancer of the mouth and throat, and also includes salivary glands, lymph nodes, and thyroid gland. It's approximately 4% of all cancers in the United States and 600,000 new cases diagnosed in the world. They tend to be more common in men and occurs mainly over the age of 65. The incidence and mortality rate increase with the age. We observe that the incidence of head neck cancer has been increasing because we have new imaging modalities to check the cancer, and also we are picking up cancers in early stage. And additionally, we can say there has been slight increase in oral cancer, especially tongue cancer in young men. When patients newly diagnosed with head neck cancer, they should carefully examine because 15% of the cases develop a second cancer at the upper aerodigestive tract, and also lung cancer occurs in these patients too. The biggest risk factor is smoking tobacco, and also chewing tobacco and alcohol consumption increases the risk. Interesting, the people who smoke and drink develop a multiplier effect and have much higher risk. So if you smoke more than a pack a day for more than 10 years, you are at increased risk for head neck cancer. We can also talk about smokeless tobacco. Oral cancers are strongly associated with other forms of tobacco. I mean, chewing tobacco, betel nut, tumba. Poor oral hygiene is also associated with oral cancers. Painful or loose-fitting dentures are also associated with oral cancers too. Wood dust exposure, chemical exposure are also associated with head neck cancer. Also, we are learning other risk factors, for example, HPV virus infection. We are finding more patients who have cancers at tonsils and tongue base because of the HPV. It's a sexually transmitted virus. It affects people who are non-smokers and usually affect younger people and also have better prognosis. Head neck cancer term includes a number of different diagnoses, so there are also a number of different symptoms. The important one is a hoarse and husky voice that has persisted for more than 3 or 4 weeks. The other one is dysphagia or difficulty with swallowing. Other symptoms is pain and sore areas in the mouth. Also, unexplained neck lump is another symptom. If it has lasted for more than 2 or 3 weeks and not connected to an infection, then that is something to be concerned about. First, your ENT doctor must be aware of the symptoms that can occur in head neck region. If you are worried, if you have symptoms, if you are in risk group, then you can contact with a specialist. He or she will take a detailed history of your symptoms and all the relevant risk factors and perform a physical examination. During the examination, it's important to examine all the subsides of the head neck to ensure that cancer isn't missed in any of those areas. So we can use flexible nasendoscope to check, to examine the areas we cannot see directly, like nasopharynx, tongue base, and larynx. It's a painless examination. It can be performed in an outpatient clinic. When the examination is completed, your specialist may request some scans and perhaps a biopsy. Treatment is complex. Head neck cancer sites involved a lot of important structures that function in talking, eating, breathing. First thing we think about when we see a patient with head neck cancer is this patient can be cured after treatment, or our purpose is combining treatments to optimize the cure and maintain function. We have 4 basic types of treatment for head neck cancer. Surgery is first, radiation therapy is the second, and the others are chemotherapy and immunotherapy. Immunotherapy is similar to chemotherapy. Surgery and radiotherapy are 2 mainstays of the head neck cancer treatment. Chemotherapy by itself doesn't cure head neck cancer, but can be used in combination with the other therapies. The last couple of decades, we learned how to compare these 3 modalities to have the best outcomes. The treatment can be changed based on the tumor site and stage. For some patients, it's going to be surgery upfront, possibly followed by radiation or chemotherapy. There will be some questions on mind like, can I be cured of this? Will I survive? Obviously, that's our top priority. And other important questions are, if I can be cured, how can I maintain my normal activity? What will my life be like after the therapy? Do I lose my organ functions like speaking, eating? You know, it's important to communicate, talk to each other, to have a meal, to eat normally or have normal facial expressions. Functional preservation becomes so important in these patients with head and neck cancer. The cancer therapy for more advanced tumors is quite difficult. We need multidisciplinary team with speech therapists and other physical therapists like nutritional and swallowing therapists. They are incredibly important. For example, radiation therapy can cause dryness in mouth and swallowing disorders. Surgery can impact speech and swallowing. Our main purpose is to reduce the impact of those therapies.